Well, hello and welcome to another episode of Chestnut Checkers. I am Keith Riddle here, as always, with Jordan Tampien, my co-host. And today's guest is a really dear friend of mine, Dr. Ray Sicilia, with Sicilia Chiropractic. And me and Ray go back, 20-some years?
I'd say about 25.
25.
Yeah.
So I don't need your story because I know some of it. But for our listeners, Ray.
Well, and for me.
And for Jordan. Oh, Jordan's still here. Sorry.
Yeah, okay. I'm just hanging out for a little bit. I slowly float off screen and back on screen. So.
Yeah. But Ray, Spokane native?
Absolutely.
Absolutely. Shadle guy?
Shadle Park, all the way. I'll bleed green and gold till the day I die.
You're still a Shadle guy, man.
Oh, boy.
I don't know if I bleed Mead Panthers as much as you bleed
I don't think you do.
Shadle. What's your mascot? Shadle what?
Highlanders.
Highlanders. That's right.
Hearing bagpipes gets my juice flowing. I tell you.
Did they play bagpipes at Shadle when you went there?
Oh, yeah.
Like for like rallies and stuff?
Oh, yeah.
Like bagpipes were a big thing?
Huge.
Really?
Oh, yeah.
pretty
Do they
legit.
still do it?
Oh, yeah.
Really?
Oh, yeah.
Nice.
Yeah. And the band joins in, and it's crazy time. It's awesome. You know, a lot of tradition. That's what I really appreciate about Shadle is a lot of good tradition, and you know, the things just passed down over the course of decades. You know, and having the Highlanders and the bagpipes, and you know, and the band joins in. It's great stuff. I'm glad they'll never change. Hopefully they'll never change. I mean, you never know what's going on with high schools nowadays, but
They're holding strong. I got faith in them.
I would say so. Yeah.
So you've been a chiropractor for how long?
31 years.
31 years. What got you into chiropractic?
Well, it's a long story, but I guess we got a little time.
We got time.
Sure.
So the story dates back to my dad. Grew up farm kid in Wild Rose Prairie up north of town. Went to Mead. He was the typical farm kid. You know, he'd milk 25 to 40 head of cattle twice a day. Go to school, and he ended up by the time he graduated, he was a 63-1 amateur Golden Gloves boxing champion. He had a full ride to Washington State.
I think that your dad boxed with my grandpa.
Yes, he did with Dixie.
Yeah.
Yeah. That's how we knew each other.
Okay.
Yeah.
The Sicilias and the Riddles going
That's
way
right.
back to
Decades to the 50s, 40s.
Wow.
You know, and he was second in state in badminton. My uncle told me a story about when the milking machine started coming out in the 50s, and the salesman comes out to sell my grandfather a milking machine for all of his cattle, and he said, "Well, if you could beat my son Jim, I'll buy your milking machine." Well, he didn't buy the milking machine.
He just milked that fast.
Yeah.
Like all true Paul Bunyan story.
Yeah, truly. And the guy was just a specimen. And as a 142-pound offensive guard, had a full ride to Washington State.
142?
142. So the guy was just a killer, you know.
Yeah.
And I heard a lot of stories from my uncles and stuff. And one uncle in particular, Bill, that built that place on Hagler Road. That
Oh, okay.
you know what I'm talking about? Yeah. And but full ride in college in 1957 was tuition. You know, it wasn't meals, it wasn't housing, it wasn't anything else. And he was always a worker bee. So he actually got recruited while he was still in high school to work for a trucking outfit. And so he got out of high school making the equivalency of today probably a $60,000, $70,000 a year job. And, so he started working and started saving. And him and my mom, they got married November 1st of 57, right after they graduated. And they put a single wide on my grandparents' property that's up out of Hazard, which, as you would know, exploded in price value and development. But so he farmed 40 acres for my grandparents, worked his 9 to 5. Well, it was more like a 2:30 to whatever, 2:30 in the morning till whenever he got up. But then he saved money and bought his own excavation equipment. So he had his own excavation business. So the guy only slept 4 or 5 hours a night, And so in 1974, when I was 4 years old, he basically destroyed his back. He ruptured his lowest 2 discs simultaneously on the job. And so basically turned him into this, worker bee specimen.
He went from
100 to nothing.
Yeah.
And basically for 4 years he was in a hospital bed in our living room. And it was, as a 4-year-old little guy, you don't realize how bad the bad is, So I don't know if you guys ever saw the movie The River with Mel Gibson, but that was basically his story. I mean, he had to sell all of his excavation equipment, pennies on the dollar, just to make ends meet, And my mom was an administrative assistant. Back then they called it a secretary, but it was, like I said, when you're that young, you don't realize how bad the bad is, and so oftentimes I was like a glorified, remote control, I guess you'd say,
Oh yeah,
and
get up and go change the channel. Right?
Yeah, exactly. Give me a cup of coffee, would you? So anyway, so he had the first injury ruptured his 2 lowest discs, so he had disc material in his spinal canal. So they had to fuse 4, 5, and 5S1 in the lumbars. But the thing is, this is pre good diagnostic imaging. So he. For the next 3 years, had one more fusion, up a level. So by the time it was all said and done, his whole lumbar spine was fused to his sacrum, right? L1 to S1. And they basically just said, well, we don't know why you can't walk, but we can't do any more surgeries because this isn't helping you, right? Yeah. And so they basically...
So during that time, could he could walk, but it was extremely painful, or
extremely.
Barely get around. Or, okay.
Yeah. His mobility was so limited; it was crazy, and you just see the pain on his face. In fact, it was heartbreaking for me because, he would be on so much pain medication that he would we're Italian, we snore. I mean, in fact, I think I might have to look into getting a CPAP because
we're Italian, we snore.
But he'd be medicated, so he would snore and then scream in pain. And do it for hours. I could still hear it.
Crazy.
It's just heartbreaking. But, he'd never wake himself up because he was so medicated. But snore and scream and snore and scream. So after the surgeon said, we can't do anything else for you, he just was at a loss. And, I'd asked him many times, why didn't you just sue through LNI? Because it was an LNI claim. That's what caused all this bad stuff. Well, the attorneys would get a third. Those stubborn-ass Italians, man, I tell you.
Right.
They when they get something in their head or a good or bad idea, it sticks. Anyway, so he got a referral to a local chiropractor because I grew up at 4300 block North Post.
Oh, yeah.
And so just 6 blocks up from the milk bottle, right? And there was a chiropractor, a guy named Bob Dreyer, that now it's Dr. Houck's building on Dr. Monroe, on just south of Garland on Monroe. And so that's where Dr. Dreyer works. So he started seeing Dr. Dreyer. And within a week or two, he was up and around with a tremendous less pain. Within a month, he was looking for work. So,
no shit.
Wow. Yeah, it's pretty incredible.
And that was like circa what, 80s, mid-80s?
1978.
78. Okay. So
was chiropractic just not looked at as a favorable treatment at that time?
Many people still don't.
Yeah, that's true.
I mean,
bit of that.
I mean, I'll be honest. Chiropractic is the redhead stepchild of healthcare.
Yeah,
I own it because I do it. I've been doing it for a long time. But there's a lot of skepticism because I think of the ignorance.
Yeah.
It's the fear of the unknown. Yeah. People aren't stupid. Yeah. They get told this, that, and the other thing by people that they trust, and I don't know how to say, their healthcare providers or their therapists or whoever. Yeah. Or, when I was, for many years, as Keith would know, because I got him into doing it, I did spinal screenings at trade shows every other weekend to build my business. But I did them every other weekend for 20 years. And, people would walk by my booth and, everything says chiropractic. And they'd walk by and say, just loud enough for me to hear that they walk by and call me a quack. Mm-hmm. And this was not too long ago. Really? So, if I ever had the opportunity, I'd say, well, why do you think like that? Well, when I was growing up, there was a kid down the block that had a cousin with a stepsister with a hair lip that had, knew somebody that had a bad experience one time in a chiropractic office. Yeah. And the stories were so over the top. And it was just so irrational, But like I said, people hear things, like chiropractors will paralyze you, or chiropractors are going to cause you a stroke, or blah, 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 or you'll die on a chiropractic table. People dramatize it so much.
Well, and I will be honest, right? Like getting your neck snapped for the first time is a little scary, right? If you just because you've watched too many Terminator movies when you were a kid, right? And I'll be like, Ray, we're good, Ray, right? Yeah. Ray has cracked my neck so many times.
Oh, yeah. Adjusted, my son.
Yeah,
adjusted. Sorry.
Sorry. The issue is it's all the vernacular. When you crack somebody's neck, nobody wants to do it. But when you do a slight adjustment, to the upper lumbar.
Well, it reminds me of a story that I've always loved, but was like, have you ever heard the story about the granddaughter and it's like Thanksgiving time or whatever, and she asks her mom why her mom cuts off both ends of the hand?
Oh yeah, I have that one.
You ever heard that story?
Yeah.
Long story short is like granddaughters or daughters watching her mom make a ham, and her mom cuts off both ends of the hams and put it into a tray to cook it. She asks her mom why you cut up both ends of the ham. And it just goes into the story of like, well, because that's what makes it more flavorful or more juicy. That's what your grandma always did it. And she's like, well, yeah, but why? Why does it make it more flavorful? She's like, well, ask your grandma when she gets here. So grandma shows up and it's the same thing. It's like, hey, grandma, how come, and she's like, well, ask your great grandma when she, long story short is great grandma is like, because our pan was too small.
Yeah.
Right? Like the end of the story is like, for 4 generations, people have been cutting the end of this ham off because they thought it was better. That's the way you did it. And there was a much more price. So I think the chiropractic thing is the same thing. It's like so many people's perception of chiropractic care is just the story that they were told from somebody who was told a story from somebody. It's like if you've ever gone and experienced chiropractic care, I don't think too many of those people have anything other than great things to say about chiropractic care, right? Because if you've ever been adjusted properly, it's like it feels amazing. Right?
Yeah. Well, good. There's good and bad in every profession. I mean, let's be honest. There's good surgeons. There's bad surgeons. There's good MDs. There's bad MDs. I mean, and like I said, being the redhead stepchild of healthcare, you're good, you're bad, you're indifferent. And if you happen to go into somebody that's not good, it almost personifies the whole profession in one person.
Just like real estate brokers.
So somebody has a bad experience one time, and they'll honestly, it's very slim to
bad
slim
news
to
travels way faster and way farther.
It's a
than
slim
good
to
news,
none
right?
scenario that they'll ever see another chiropractor the rest of their life.
Right.
And I run into that all the time. New patients come in because their spouse is getting wonderful care and they've had problems for years or whatever the scenario is. And they said, well, I had this bad experience. And I'm like, well, I'm glad that you're in here and we're going to talk about that. And I'm going to talk you off the ledge. And we're going to, in fact, Karen, your assistant back in the day, it was kind of funny because she'd heard good and bad, and she was a new patient. Her back was killing her. And so, I have those patients that they'll bellow every now and then when I adjust them. They'll go, oh, and it's just that persona, And so I took a history from Karen. She's in my exam room waiting for me to get done with this other patient. I had one of my screamers. And he let loose for a few times. And so I walk in the door to, go, examine, his assistant. And
she's like, don't touch me.
So
I walk
wrong building.
I walk in the door. She looks at me with the deer in the headlights look. I mean, like terrified. And she's on her phone. And I said, oh, you can, quit playing games on your phone. Let's get the exam done. And she goes, no, I'm making a call to get somebody to come pick me up. And I said, well, let's just talk about that for a second. This, if you've, I could probably worked on 3 or 4 other patients in that time. And nobody made those noises except for the one.
Yeah.
Right.
You know what I mean? And so, but like I said, talked her off the ledge, got her good care. She got better. Yeah. And when she needs it, she comes in. Yeah. And it's kind of, but it's an interesting dynamic.
Yeah.
I mean,
you have no margin for error. That's the hard part. Like, think of how many times a doctor messes up.
Right.
It's just assumed you're going in and there's a chance of failure, right?
Right.
But it's like they're coming into your practice like waiting for the failure, and then that's what goes on.
Yeah, you
like,
go to the doctor and they give you
like,
some meds, and you get a rash, and you come back and you're like, Doc, I got a rash. You're like, oh, sorry about that. We're going to try something
We're going to try something else. And you
Yeah.
just say, oh, okay, that's the doctor's. Like, literally on mine, I couldn't golf more than 4 holes before my lower right back hurt. Just hurt. And I got recommended to clear on the South Hill. Mm-hmm. And what I love about chiropractic, it's holistic. It's your whole body. And she's like, Jordan, it's not even your back. It's like up here in your neck. Your gait's off by like a full inch. They did 1 adjustment. That's it. Only time I was adjusted. And then I'd come back, they'd check it. My back hasn't hurt since. I'm not saying I'm a good story for it, but I think sometimes when I go to the hospital, it's how do I the thought is how do I mitigate pain? Mm-hmm. When I went to the chiropractor, it's how do we fix this for you long term?
Right.
And that's the beauty when I saw the difference of like, I don't need pain meds. I don't want this pain.
Right.
And you here can't tell me why my lower back hurts. This person diagnosed it in like 20 minutes and didn't even look at my back. I'm like, so you got a proponent of it. I shout it from the rooftops because I think a lot of people had a bad experience. And so I wasn't sure it was bad because not the concept, not the industry, whatever you want to call it, has changed so much from like the 70s to the 80s to the 90s to what it is now. But I feel like the experience now is so good.
Yeah. Well, the research is out. I mean, and there's been research for years.
Yeah.
I mean, even the AMA did a low back pain study on 2,000 patients, compared every discipline in this country that treats low back pain, and determined that 70% should be seen by chiropractors first. Yeah. But that was published in October of 2013 in the journal. 2013 in the Journal of the American Medical Association. But you show me a physician that knows about that study, I'll give you $1,000 because they don't know, and nobody really cares, to be brutally honest. I do have some physicians that refer to me. It's not the norm. Because it's just not.
Well, they'd
their
rather
method of
treat
thinking.
it like surgery.
Right.
Hey, let's fix this through surgery. And you're like, well, wait a second.
Yeah.
It was feeling fine before. It doesn't work now. Like, there's got to be some in between.
Right. And pain meds, and stuff like that. And now they're pulling the reins on the pain meds a lot because of the opioid epidemics and stuff like that, which is a good thing. But, when people are in extreme pain, they need that stuff. It's just they can't stay on this stuff. You know? But
So back to your story with your dad
sorry,
you saw the difference at a young age.
oh my gosh, yeah.
You
It
saw
was always the most positive thing in the entire universe.
and that's what motivated you to become a chiropractor.
Well, I always wanted to be a doctor. And anyway, took my SATs. And I was always in AP classes and all that kind of stuff. And had a bad morning taking the SATs. I got 1170. My original plan, was to go through ROTC, get my MD, and then, put in my time and then get out in private practice. And so I got 1170 on my SATs. Well, minimum SAT scores for ROTC was 1250. So I got the letter, "We regret to inform you," blah, blah, blah. So I'm getting ready
still the same today?
Yeah. They probably lowered it, but
I'm sure they probably did lower it. But,
there is a minimum score.
Oh, yeah. There has to
get
be.
in ROTC?
To ROTC programs, You have to qualify because you have to qualify for that. It's not like enlisting,
Right.
right? So you have to.
Yeah, because then you go through college and then you come out an officer.
And
Right.
they pay for X amount. Julie, my sister-in-law, did that program at Whitworth.
No, it's fantastic, and it puts out a lot of good thinking, servicemen and women, But like I said, I was in the career center, kind of licking my wounds and, getting some stuff. And a buddy of mine, and he goes, "Well, have you ever think about chiropractic?" And I just thought, it was like Thor's hammer hit me in the back of the frickin' head. I was like, that's what I need to do, And I just had brought back all the memories and all this stuff, remember when I was like 10, I'd say, "Hey, where's Dad going?" "Oh, he's going to chiropractor." "Oh, great. Well, maybe we can play catch for like 10 minutes. Do stuff that a father and son should be able to do, but he was never able to do, you see. When I started hunting, after I met you, it was like 2001-ish. I shot my first deer, it was a very emotional thing for both of us because he always wanted to take me hunting but he couldn't. Just physically couldn't. You know what I mean? And the physical limitations that were put on him by all those surgeries, you can't reverse that stuff.
Yeah. So even though you're getting a good chiropractic care after that and you feel good, you still have fused 6 vertebrae?
You also have to retrain your body at that point.
Right. And the thing is, I adjusted him up until the end because, I would use gentle touch stuff and activator and a couple other light force techniques. But his sacroiliac joint still needed to function. You know what I mean? And those are the joints that hold the pelvis together between your sacrum and your pelvic bones. Those two big joints that hold that together. Now, those problems actually affect more people. Actually, they affect everybody in some way, shape, or form. But I adjusted both my parents up till basically the day they died, and in fact, today is my dad's 6th anniversary of his passing. So I just realized that this morning when I had to write a couple checks, go to the bank, and I was like, oh man, March 26th, F you,
Yeah. R.I.P.
F you.
But no, it's an interesting dynamic, and I get people coming in that, like I said, they're not a little apprehensive; they're downright freaking terrified. Terrified.
Well, and some of the stories I love too, and we don't have to stick on just your chiropractic care, but I think it's such an amazing story. But like some of the stories I love too, like because I brought Ray, my daughter, when she was like 4 days old or something like that.
Yeah, the first adjustment.
Yeah. And it's because there's so much, the little babies are cramped in there, right? Like, but there's so much some just knowing Ray as long as I have. But it's the stories you have about people that like, they're constipated. Or they have something like, and they don't realize it's like, oh, you can adjust your spine and like, your
Acid
bowels
reflux
move
is a big
better.
one.
Acid reflux, those are kind of the stories that made me scratch my head initially, but we're also like, oh, that's so crazy, right? But it makes sense when you just think about it for more than 30 seconds. You're like, well, your spinal cord is like this huge cord, right, of all these nerves that control all these things. And it's like, well, it makes sense.
It's like where power shuts off if you cut a cable.
Right.
Just can't transmit the same.
Yeah, I helped a 3.5-month-old with their acid reflux. I mean, since he had been born, the grandma I went to high school, known since 9th grade. And I started working on her daughter when her daughter was in middle school. And daughter moved to Montana with a boy, got married, had a baby. They, and where she lives, I think she's in Paulson. I'm not sure, but it's real expensive to get started, and they don't take insurance and all this kinds of stuff. So she's like, well, I'll just wait till I come back, see mom, and see Dr. Ray. And so anyway, she comes in, and grandma's holding the baby, and the baby's just fussy, just constant. She's walking around the waiting room holding the baby, trying to.
Oh, so she didn't even come in to have the baby seen by you. She came in to get seen by herself.
Right.
Okay, gotcha.
Right. And so, they come in the treatment room and we're talking, and grandma's holding the baby, kind of trying to rock it and calm it down, just fussy, spitting up all the time. So I said, well, let me check. You want me to check him? I can check him. I'm not, if I do something, then I'll charge you. But if I don't do anything, I'm not going to charge you. But just let me check him, And so it's kind of funny because people have asked me, do you adjust babies? I'm like, absolutely. And then, oh, you must be, that's so brutal, blah, blah, blah. How are you popping babies' backs and necks and blah, blah, blah. And it's just, I mean, you remember watching me adjust Charlie. I mean,
it's like
it's fingertips stuff. I mean, it's mobilization and just, barely light touch, And so I adjusted him, but then I thought, well, let's just check his little tummy because sometimes babies have hiatal hernias, right? So I just did a little traction right below his xiphoid process, which is the base of your sternum, and it went bloop, and he just shut up instantly. Shut up. He was just like, "Oh, hey, I'm cool now."
Yeah,
right.
Crazy.
Yeah. So I mean,
is it kind of like burping him or something?
No. Hiatal hernia is where the part of your stomach it pouches up. So you have hiatuses in your diaphragm. So you got the esophageal hiatus. You got the a couple other hiatuses. I'm having a brain fart. I can't believe I'm doing that right now. But they're the holes in your diaphragm where the tubes go.
Yeah.
Gotcha.
Basically.
Gotcha.
And so the esophageal hiatus is where the esophagus goes down, and then right below that's the stomach, right? Yeah. Well, part of the stomach is called the fundus. It'll pouch up and herniate through that hole.
It's pressing on that.
Yeah. And I've worked on it on adults. I've worked on it on children, but this was just so dramatic.
Yeah.
And it was just fingertips, like I said, just doing some traction right below the xiphoid. And it went, like I said, felt a little bloop. And he's just like, whoa, what was that? And he quit crying. And he laid there. And I look at mom and grandma, and their just eyes have got like real big, and pick him up. And grandma sends me a private message via Facebook about 3 hours later, all caps, thank you, thank you, thank you. He is a completely different baby. I mean, he's eaten 4 times already since you've seen him, hasn't spit up anything. And commonplace for him was he'd eat, he'd spit up.
Oh, makes
every
sense
single time.
now.
Yeah. But I mean, he was sleeping. I mean, he was just, and because they live in Montana, I mean, that's not a hard procedure to do. So I showed mom how to do it because she was in town for a few more days.
Is that something that will typically repair itself over time or
over
stop
time.
happening?
Yeah.
Oh, okay.
Because the thing is, the diaphragm's still got to contract back around the esophagus. You see, so
I don't know about any of this. So I'm like, yeah.
Well, I'm just nodding.
Well, and the thing is, you have your aortic hiatus through the stomach and all, or through the diaphragm and all these things. But it's just so interesting. I've had so many little things. People coming in. There was a gentleman. Do you remember Deputy Craig?
Oh yeah.
Passed away.
Dare guy.
Yeah. And he and I'd been friends since high school, and. Played ball against him. He went to U High. I went to Shadle, and we had mutual friends. So after we graduated, we started, going, seeing each other at different functions. I don't want to get too, intricate about what we did back in the day because there's no cell phones, and I'm really glad there weren't.
Yeah, so we don't have to.
Better times.
But he was actually dating my then office manager, and he came in and we were chatting, and he's like, yeah, my daughter, she rolled her ankle in a volleyball game 4 weeks ago. She still cannot put any weight on that foot. Yeah. And so I'm like, well, bring her in. Let me check her. So he goes out and gets her, and she crutches into my room, and he fills out the paperwork real quick, and I check her pelvis and stuff like that, like I'm talking about, because anytime you don't walk right, it affects your pelvis and everything else. So, she was off down there, and then I adjusted. There's a bone just distal on the bottom side of your tibia called the talus, and it'll, with an inversion sprain where your foot rolls inward, it'll shift laterally. So, but if you don't put that back into place, it's constant irritation, constant pain. And, she's 14 years old, freshman in high school, and I adjusted that talus. And I said, okay, stand up. She stands up, puts equal weight on both feet. 14-year-old little girl looks me straight in the face, goes, what the hell did you just do to me? And I'm like, well, welcome to the world of chiropractic, And so, I mean, it happened with, I had a new patient who's a star volleyball player, and she's a trackster. Obviously, I can't mention any names, but she just has a new patient came in a couple of days ago and had been chronically rolling her ankle. And so she's got a track meet today. Yeah, today. And she throws jav, and she's a sprinter, but from the ankle injury she had, she's chronic pain in that ankle. I adjusted her ankle. She stood up. She's like, what in the world? Yeah. I said, it doesn't hurt. Yeah. And it's fun for me to do stuff like that, because a lot of people just don't have any idea the expanse of my knowledge base. Yeah.
Yeah, I mean, I feel like me and Jordan do the same things.
I mean, exactly
all the
same
time. People are like, Keith, that's amazing. How did you do that? No, it's different career, like different reward. They're like, I don't care what you did today. But you got to make people feel better, which is awesome, and that's cool that it was a testament from actually something really good that came out of something that was not so great with, which is your dad's story.
Right. Yeah. No, I change people's lives every single day.
It's true. Yeah, Whitney, my wife, always got migraines. Mm-hmm. So the only thing that ever helps is a chiropractic adjustment.
Absolutely.
Yeah. And so then she kind of maintains that, and so far helps. But
switching gears really quick though, because I think this is something I want to talk to Ray about let's talk about building your business. Because you alluded to it a little bit earlier about doing trade shows every other weekend for, how long?
20 years.
20 years.
Yeah.
And you've built a pretty, respectable, good-sized chiropractic. I don't know how it ranks in town with other, but I'm saying, let's say you've built a really good practice, and you've done it primarily, on your own. So, what does that look like for you, back then and today? Getting from where you were to where you are, outside of your dad and the reason you got into chiropractic, and then kind of the misperceptions around chiropractic. You've built this practice over how long?
31 years.
31 years?
Yeah.
So what have you seen that's been the biggest changes? And then how did you build that business over 31 years to where it is today? Because I think that's what I'm really curious about talking to you about today.
Yeah, no, the thing is, I'm very blessed to have friends that do things the right way. You know what I mean? There's a group of 6 of us, me and my buddies from college. We all graduated together, and we've been getting together. In fact, this last year was our 30th year getting together. We annually take a trip down to Cabo. But anyway, our first real trip was my buddy in Bellingham, a guy named Eddie Hansen. He owns 9 practices up and down the I-5 corridor. Very special guy. He's in fact president-elect of the Washington State Chiropractic Association. So anyway, we're on our first annual guide trip, on his 35-foot double-decker Ocean Bayliner. We've all been in practice a year and a half. I'm seeing 10 patients a week. He's seeing 150 patients a week, right? So I don't scuba dive, but all the other guys scuba dive. So he's positioning the boat. He's up on the bridge, positioning the boat for the guys to go scuba dive, get us sea scallops for dinner. And he pulls me up there, and he's like, so how's practice? And I just kind of hemmed and hawed, kind of brushed it off. He's like, no BS. How's your practice? I said, it sucks. I said, I'm going down in flames, and I don't know how to put out the fire. And he goes, well, Ray, you're a great chiropractor, but I guarantee you're a shitty businessman. He goes, you need to learn the business of running a chiropractic office. So he invited me to a practice management seminar. So I walk into this seminar, and a couple hundred people, a lot of these people are very, very successful doing the right things. And so that taught me the business of running a chiropractic office. What the biggest thing is you can't build your business when you're sitting in front of your diplomas. You got to get out and meet people, and that's when I started doing the trade shows. And so when you put yourself out there in front of God and everybody, but what I've noticed is a lot of it's focus. It's how am I focused on my business? Good things happen when you do. If you're not focused on your business, good things aren't going to happen as good as they should. And a long time ago, it just kind of hit me out of nowhere that my mental state is going to determine how my business runs. Am I focused on what I need to do? Am I focused on building my business and getting into things like Business Networking International and doing things like that, meeting people, talking to people, because if they just see my name, they don't know who I am. They don't know what I can do. They don't understand what I can help them with, But doing the trade shows, like I said, when I started doing that and started showing people, because the device that I used had 2 scales which would measure your weight distribution. Then I would do a posture screen with the hips and the shoulders. A pretty simple procedure, but it would show people, when they would see how far off the hips were and how far off the shoulders were and all these kinds of things, it was very eye-opening for them. So, like I said, I'd screen about 5,000 people a year for 20 years, and, being able to just talk to people and, get a one-on-one with them in a small capacity, of course. But that's what I found was the most valuable thing for me. And so I started doing all those trade shows in like 97, right? And, by the time, 2017 rolls around, I felt like I was at a chiropractic convention with just a couple other booths, because all these other, chiropractic offices started piggybacking and started doing that stuff too. And then, of course, COVID hit and, couldn't do any of those things. But luckily by that time I didn't have to do anymore. But, doing networking groups, like when I got you into BNI, and that was that 04?
You got a better memory on that
04,
stuff than me. I don't know. A long time ago.
Yeah, long time ago.
20 years ago.
Yeah.
Sure.
Nah, it was, But so some of these conversations for me, I think they sparked the trip down memory lane, but also, so I've known Ray for a long time, but I met Ray, and Ray is like, we're about a decade apart. Ray's super old.
Super old.
You gotta get my digs in when I can.
Old as good.
Right. But he was a decade in front of me, as a person, but also business wise. And so when I was a young real estate agent, Ray was kind enough to get me into was BNI, Business Networking International, but even just talk to him about what he's talking about right now, which is just like, how's your business? Yeah. Getting in front of people, just making connections, networking, all of that kind of stuff. That I think a lot of, our listeners or people that have businesses or entrepreneurs or small business owners, there is no school for small business necessarily. Maybe there is, actually. I should take that back. There probably is a small business school. There literally is a small business school.
There's degrees for small business.
Right.
But there's no kind of school of hard knocks. It's a lot of it's done through mentorship. A lot of it's done through relationships. Yeah. And so I think there's something that was, I think, invaluable about, meeting Ray and becoming buddies, but just having somebody straight ask you to your face, like, hey, Jordan, how's business? Yeah. And then also having the stomach or the balls to look back at someone and be like, terrible. Yeah. I'm drowning. I don't know, or good, or and having those conversations with someone to say like, well, what are you doing? What do you look like? And then the dichotomy between being good at your craft and also generating business or managing business, right? Because you can have all the knowledge and be a great chiropractor, but if nobody knows you exist, or if you don't have business savvy, it doesn't mean anything.
You're still going to fail.
So it doesn't matter whether you have a coffee shop, whether you're a real estate agent, whether you have a chiropractic, it doesn't matter what your small business is. There is definitely a dynamic that I think a lot of people don't know about until you know about, or that doesn't get talked about a lot, which is there's 2 parts to every business. And there's the craft of whatever you do. I'm a welder. Great. Can you do billing, shipping, receivables, taxes, bookkeeping, all that kind of stuff. So those relationships I think are invaluable, but that's something that I really looked at what Ray's done, and I'm kind of, in awe of or appreciate is the fact that you've kind of learned both those angles. Mm-hmm. So what you go to that business seminar, your buddy says you should go to it or whatever. What happens after that?
Well, now this is when I was making less than money. You got to understand. I mean, it took me probably, because I didn't have anybody working my front desk for 3 or 4 years because I didn't have any money to pay them. Because I wasn't making any money. If you see 10 patients a week, I mean, you do the math. That's not a lot of money. And so I was all in, and I signed up for, now this is like I said, 1997, $400 a month commitment for 3 years. And I was terrified.
Was it like a coaching program or like a mentorship?
Yep. 2 coaching calls a week, and then they give you some scripts to go by, and and all this kind of stuff, and you just learn how to talk to people, and then you put it in your own way. You know what I mean? And so but not knowing how to talk to people. I mean, prior to that, people would come to my office and tell me what I'm going to do. I'm like, okay, but after that, you have to have the confidence in yourself and in your skills to be able to relate to people, but say, look, I'm the boss here, and we're going to do it my way. Because if you listen to me, we do the right things, you will get better. And there was one time I had a gentleman come in, and 6'7" financial broker, and the guy was just can I swear?
Yeah.
He was an asshole.
You can swear, but you cannot ask permission to swear.
Yeah. Okay. Then it negates the effect.
Okay. Well, he was an asshole. And he comes in, and his plantar fasciitis was so bad, he was walking on one toe and one foot. And he comes in, and the thing is, his daughter and son-in-law had started coming in a few months prior and just praised my name to him. Well, he comes in, he says, well, and at that time, there was a chiropractor right across the street from me. Right across the street. I mean, you walk 20 feet and you're in his office, right? Yeah. And
that's so crazy, right? To think of something, not to interrupt your story, but to think of something like chiropractic care, which is not that prevalent, right? Like, it's not a gas station. There's not one in every corner. And then you just happen to have another chiropractor in the same size town that we live in, directly across the street.
Yeah, directly across the street. And he was a really nice guy. Yeah,
of course, they always are.
But it was kind of funny, and his name was Brian Flake, and his chiropractic office was Flake Chiropractic. That kind of made me chuckle.
Anyways, and so the asshole guy comes in.
So he comes in, and he starts telling me what I'm going to do. Yeah. And he'd been dealing with his plantar fasciitis for 4.5 years. And I said, whoa, let's slow down there, Kimosabi. I said, do you see this area you're standing in right here? I said, this is my playground. I said, yeah, this is where I make the rules. I said, if you don't want to play by my rules, go right across the street and see the other guy.
Go see Dr. Flake.
Yep. And he goes, oh, no, I heard you're the best, and blah, blah, blah. And so I started working on him, and within 2 weeks, he's walking normally. Hadn't walked normal in 4 years. 4.5 years. And, but like I said, the way his pelvis was and everything, just the abnormal weight distribution and all that kind of stuff that causes so many of those issues.
Causes ancillary problems as well. Yeah.
Exactly. And so, then he just stopped coming in. But he never had back pain. It was only plantar fasciitis pain. But I worked on his back and his foot to take care of the plantar fasciitis. And like I said, in 2 weeks, he was walking normal. As he hadn't walked normal for a long time. So a couple weeks go by, and I think, well, I'll give him a call because, life does happen, But a 4.5-year problem doesn't go away in 2 weeks. I'm sorry, it just doesn't. That's an impossibility, So I call him up, and I said, when he comes back? He goes, well, my back doesn't hurt. I said, no shit, it never did. I said, I'm treating your back and your foot to fix your foot problem. I said, when he come back? Well, my back doesn't hurt. I said, well, you have a nice day. And then his daughter comes in about 6 months later and says, yeah, I had to have back surgery. Yeah.
Jeez,
true story. Yeah, but I have to have had the confidence in my skills that if I think I can tackle a problem, I can tackle that problem. Yeah. I lay law with all my patients first day. I give them an opening spiel. I said, I have 2 concerns. First concern is what's causing your problems? Why are you here? Second concern is if I can help you get rid of those problems. Yeah. Now, I'm going to ask you a bunch of questions. Well, we need some good, concise answers. After that, and I'll do an evaluation after that. After that, if I think I can help, I'll talk about what you got going on specifically, and we'll map out a plan to get you better. Yeah. Now, if I don't think I can help you, I will refer you directly to somebody I do believe can. And I tell him,
his name's Keith Riddle. He sells houses.
Right.
He is not licensed, FYI.
Right.
He'll take care of all of your problems.
Yeah. And but then I say, if we decide to proceed, then I expect to work as a team. Yeah. Because if we don't work as a team, then I really can't help you, because it's not about what I do in the office. It's about what stretches and exercises and things I can do, get them to do at home to enhance and, incorporate into their daily life to, help themselves, And a lot of people just expect everything from me, and I've had people drop that on me. Why don't you just do more? I'm like, no, that's not how it works. I said, I'm not going to walk around with you 24 hours a day and tell you everything you're doing wrong. I said, what I could do is I could give you suggestions, I could give you stretches, I could give you exercises so that you can help yourself get better, you know?
Yeah, there's something to be said for that. And I like said, the cynical side of Keith is like, but that's why the doctors and the pills work so well, right? Because a lot of times people don't want to do the things that they need to do to make themselves better. And if we're just being candid, if they did, then we wouldn't have the crises in this country that we have, right? We wouldn't have the depression and the anxiety and the obesity and all of these things because people, it's like, hey man, like your mental health is important. You should do this or that, or like your back's important. And it's like, no, I want to go somewhere. I want you to make me feel good. And then I want to leave and never deal with it again. And it's like, well, it's not.
That's not how it works.
But the fact that you're here and you had this problem for 6 months or 2 years. And so I think that's one of those. It's a duh thing, right? We're like, yeah, duh, like we all know this, but it's also one of those things where it kind of just drives you crazy because you're like, man, if people would just help themselves or do these things, how do you deal? Maybe that's a better question. How do you deal with that, right? I mean, it's got to drive you nuts, right?
Do with what?
Like the patients that just don't do the things they need to do to get better.
The guy who needed back surgery.
Job security.
Yeah.
Yes.
You mean like the Keith who's on a twice a month plan?
Yeah, he's like, yeah, go ahead, keep chopping that wood out back, buddy.
Yeah. Well, and it's funny how,
It's like starts snowing and Ray's like, ooh, a lot of people are shoveling
Snow
today.
shoveling. That guy's not ready.
yeah, I missed out on that this year. Doggone it. But yeah, no, people want to blame me for their problems.
Yeah.
You know, they've had people come in and they're hurting and they walk in and because I can't fix their whole life and their world in one adjustment, you know, they think I'm the problem. Yeah. And I'm like, no, you walked in here with the problem. Yeah. You caused your own problem. Hardest thing for people to do is look in the mirror and say it's your fault. Yeah. You know, and it's one of those things. I mean, I have a really crappy knee. In fact, in a year I'm going to get it replaced, and it's just gotten exponentially worse. But the thing is, I know that because I can't lift my legs, I'm becoming unstable in my low back and in my glutes. So in the beginning of December, my low back was killing me. And I get adjusted once a week whether I pain or not. Because every single patient I work on, I bend over to the waist to 90 degrees 15 times on average. On a busy day for me, 75, maybe 80 patients, you know. And so what's that?
75, 80 patients a day?
You say a day?
In a day.
Yeah.
Yeah, things have been a little bit leaner lately. I don't know why, but maybe the gas prices. But, you know, the thing is, you know, that's it's one of those things that, you know, should I wait for the pain to show up or should I be proactive in my health?
Right.
I mean, I've worked out my whole life, you know, but the thing is I haven't been able to work out my legs. So like I said, I got unstable in my glutes and my low back. And it felt like somebody had a electrified ice pick in my back. It was just the worst. It was like, you know, but when I could like tighten up all my muscles, the pain would go away. And I'm like, okay, dumbass, you're unstable.
Yeah.
So I had to start doing my butt exercises and, you know, stabilize my low back and my glutes and my legs as much as I can within the confines I can with my crappy knee. But, and like I said, I like to practice what I preach, you know, and you know, if you don't, I mean, I don't just want to talk the talk. You know, that's why I see my guy every week, and you know, we adjust each other all the time. You know, but the thing is, I know that's what my body needs. You know, I ask people, well, did you brush your teeth today? You know, they don't come in for 6-8 months and then they're horrible again. And realistically, probably about 65% of what I treat is repetitive stress. Yeah. I mean, why does a truck driver have bad low back? Because he's a truck driver. Why does a dental hygienist have a bad upper back and neck? It's because their arms are up and shoulders up around their neck 8 hours a day, you know. So am I going to tell them not to be a truck driver or not to be a dental hygienist? Absolutely not. Yeah. That's stupid. You know, my job is to get them better. Yeah. And then, like I said, get them on some home programs and things like that. I tell all my patients I want to be your chiropractor for life, just not 3 times a week for life. But if we do the right things, you know, it's like somebody that, you know, is 100 pounds overweight and they hit it hard and they just go balls to the wall for 6 months. They accomplish their goals. Do they still need to go balls to the wall after those 6 months? Well, maybe if they're going to compete or do something like that, yeah. But if they're just doing it for health reasons, they don't have to work out 7 days a week anymore. They can taper down. They can maintain, you know. And like I said, do you brush your teeth every day? Well, of course. Right. Why? Do you brush your teeth really, really good today? Why don't you just wait until your teeth hurt to brush your teeth again? Yeah. Well, that's stupid. Right?
Yeah.
That's gross. Yeah. And I'm talking to you.
Yeah. because I don't like to brush my teeth.
I mean, you did one of the harder jumps. I think the hardest thing for people to do is take a passion or something they enjoy and then turn it into a business. Like you see it in breweries a lot. The brewer loves brewing beer, but never converts into a business. And a lot of times it's because they don't have that person or team around them saying, hey, look, you're probably great at this, but you suck at business, right?
Right.
And I think too often we miss that piece. But what were like 3 things after that, whether through the coaching as one of them, but that you bridge that gap to the point where now instead of 10 a week, you're doing 80 a day? Well, obviously years in there, but just proactive things.
Yeah, well, like I said, getting out and meeting people, doing networking groups. Early in practice, I was actually in a group called Rotaract, which is more of a community service group. But getting back to more of the present, like I said, it's just staying focused. It's staying on top of my mindset as far as what do I need to do to keep my business on track. And getting a good team behind you is really key. I mean, I've hired some wonderful people. I've hired some dipshits. And, I really have a good A team right now. And they keep me on track. And, I start getting a little bit behind. I start talking a little too much with my patients because I'm pretty chatty. They'll come and knock on the door. Okay, we got 6 people now here waiting for you. Quit messing around.
Yeah. So but when you say focus, what part? So let's say I just started my business. What would you recommend somebody focus on? Is it get out to those networking events? Is it make sure when somebody comes into the office they have a unique experience? Is it the branding? But like when you're dialing in somebody to focus, which part are you?
Yes, and yes. I mean, when you have somebody in front of you and you have to appreciate the fact that they're there for your help. Yeah. You know what I mean? You have to actually love the fact that they are there for you to help them. You have to be focused on them 100% of the time when you're with them. And asking the right questions, doing the right things, trying to get to the base of the problem, as far as any other business. I mean, if you are not getting out of your comfort zone, then you're not doing the right things. You have to get out there and put yourself out there in front of God and everybody. I mean, focus has a lot to do. I mean,
focus has a lot to do with not just focusing in the right time and place when you need to focus, but knowing what you need to focus on.
Correct.
And when you need to focus on it.
Yeah.
So like not to answer that question for you, Ray, but when I heard Jordan ask it, the first thing my mind thought of is like, well, it's completely dependent on what I need to focus on, right? Like when I think about my own business, right? Like I just framed it for me and I'm like, well, when I don't have enough business, then I need to focus on my marketing and advertising. Yeah. And that's what I need to focus on, right? And then, but when I'm with a client, I can't be sitting there daydreaming about marketing and advertising when I'm sitting across the table from someone who wants to sell their house. Yeah. I need to be focusing on that person, their unique experience, their home, their pricing. So it's kind of like, I think as a savvy business person, it's like, it's a 3-step problem, right? It's first knowing what you need to be focusing on, like being honest with yourself, being transparent with yourself. Where am I winning and where am I losing, right? And then it's, okay, now I need to focus in those areas, but I also need to be able to be nimble enough to shift that focus. You can't be a one-trick pony in this game, right? You got, hey, if it's tax season, man, and I got to get these done, then all of a sudden I'm a CPA for 2 weeks. It's like focusing where you got to focus on. And I think that is a separator or a differentiator when you look around at people that I would consider are good operators. There's people that have that skill set, that have that mastered. Okay, I know what I need to do, when I need to do it, and then I have the skills to do it in that moment, right? Yeah. And I think with anything, I think that rings true.
And having the confidence in your skills to get it done.
Yeah. And you're not going to if you've never done it. And there's so many things you have to learn. Right? I guess what I'm saying is it's easy enough to say, my business sucks, and I need to focus on marketing and advertising. And if I just turn around and focus on marketing and advertising 3 hours a day for the next 2 weeks, I'll generate enough business. That's only true if I know marketing and advertising.
Correct. Right.
Yeah,
can I perform when I get the client in my office?
Yes, exactly.
Yeah, the business sucks, and I go out and spend 4 hours a day on my social media thing. That'll do it, right? I think some of the issues are there are so many things. When I said focus, I was thinking, I agree. One of my issues is always the lack of focus.
And it sounds cheeky for you to say, hey, Ray, if I was starting my business, what would I focus on? And then I'm over here going like, the things that you need to focus on.
Right? Because you're sitting there, and then it's like, so in my world, what happened was just implementing tools to help do that. So then I time block, which I've never done. I had never done before.
I was a
kind
Nazi
of took the
time
problem.
blocker.
Yeah, so I just took whatever came at me, and I thought that's running a business. And instead, no, you can be proactive. You can get ahead of those things. But I think too many times we come into this, and it's the most overwhelming profession. I don't know why anybody chooses to own their own business, actually. It'd be way easier to go work for somebody else, show up, do your job, go back. But I think for the people that can manage this part, because now it's easy, right? You're tweaking. Like, and my weird addiction is startups. I love startups. I love the fact it's zero and we're going to build it. But the downside of those is you have to deal with that chaos and find ways to not let one area take you off focus of what those targets are.
Right.
And so kind of, I think when somebody says, yeah, my business sucks, here's what you need to do. It's not like it just turned into that and now 20 years later you have this because you went to a trade show.
Right.
You were implementing things each day.
Right.
What do you think went from that boat trip to the next 4 weeks? What were things you just started implementing or having conversations with yourself about of what you need to do to get there?
Well, listening to my coaches.
Yeah.
That was a big deal. Getting verbally bitch slapped. You got to take the good with the bad.
Yeah.
You got to learn where your faults are. You got to learn where your weaknesses are. If you don't know your weaknesses are, you're not going to improve on them.
Yeah. I mean, I call that being coachable, right? I mean,
Yeah.
and whether you're an athlete or a chess player or a business owner, I think there's just so much to be said about being coachable, period. I mean, and as a person who does coaching and consulting for people, it's like there's nothing more frustrating than being a doctor and knowing they're going to leave your office and not do what you said. Right. It's nothing more frustrating than being a coach or a consultant and talking to somebody about their business and you're like, that went right over their head, or there's no way in hell they're going to do that. And then them coming back 2 weeks later and they're like, same problem, and you're like, yeah, you're not coachable. You just have to own your shit, right? Like, hey, you're not doing the things that you need to do to be successful. What do I need to do? These things. Great. Go do these things. Come back. Did you do these things? Well, my dog got sick and my car broke down. You're like, oh, fuck.
Yeah,
so we're here again.
Because I have a pretty good direct question that I had a coach reach out to me. I'd met with him for lunch about helping me coach through this. And I keep pushing him off because I'm like, I need to solve this part first of what I'm working on. Couple closings, things like that. And he wrote back to me and was like, well, this is the exact reason you need a coach is so you can do this. And so I'm trying to figure out, because I feel like it's come up now the last 6 times, but how important, and it sounds like pretty important, but was that coach to where you're at now?
Oh,
like
extremely.
getting that. Yeah.
Oh,
yeah. And I think
exponentially important. I mean, and like I said,
what would you say to somebody, and this is my selfish ask,
yeah,
right?
I'm trying to circle.
What would you say to somebody right now who's scared as shit to stroke that $400 check?
Yeah.
Because I mean, coaching, in our world, this can be anywhere between $1,000, $1,500 on the low end to $2,000 a month for a small business or real estate coach. But I have a lot of people that's their hurdle. They're like, oh man, I don't, I'm barely making $25,000 a year. And you want me to sign up for coaching and spend $12,000? Yeah. It's like, I know how it sounds. Right. What would you say? Like, how did you?
How did you get over that hurdle?
In my personal experience, I was fucking terrified.
Yeah.
Terrified. And I've actually asked my wife a couple of times, if we were together at that time, would you have given me the green light to spend $400 a month for? And the thing is that the coaching, the practice management company made no bones about saying, if you don't pay us, we will sue you and we will win because you signed a contract. So, the thing is, one question my buddy Addie asked me goes, what in your life, because this is before I met my wife, what in your life is more important to you than your practice? Absolutely nothing. Yeah. Absolutely nothing. So
I'm glad he premised that because Laura could be listening to this.
Yeah.
We want Laura to know.
The thing is,
this was pre you, Laura.
But that's more common sense.
Yeah.
Mm-hmm. And when it was either feast or famine.
Yeah.
Either you're going down in flames, or you're going to pull yourself up by your bootstraps and you're going to get some shit done. Yeah. Listening to the coaches, doing what because they had a recipe for success.
Yeah.
And my buddy's a testament to that. I mean, how special it is for a person to own and operate and have 9 successful practices. Yeah. It's freaking insane. I mean, as you well know, it's crazy because you got to deal with the egos of the doctors. You got to deal with all the real estate. You got to deal with all the taxes. You got to do all the hiring and firing, And so now he's just such a brilliant businessman. He's actually doing what Winco did. He's selling his practices back to his employees. Smart. And now he doesn't have to practice anymore, but he is their consultant. He's their main consultant and makes a mint doing that. But he doesn't he treats patients just because there's 15 patients that will never, ever, ever let anybody else touch them. So he treats for an hour a week, but he makes a ton just coaching.
Well, and diving in there a little bit too, I think it's important to kind of know what you're trying to do or where you want to be. I mean, because we've had this conversation a little bit, but you like practicing.
Love it.
You love it.
Yeah.
And back when I was growing my business, at some point I got to a point where I wasn't in the field very much, if at all, right? Like I very rarely was interacting with clients on the buy and sell transaction, but I had turned into kind of like a real estate brokerage owner or team owner. My day-to-day now was running that, right? And I think I did that probably unknowingly, but at some point realized that's what I did every day because you got to do it different. You know what I mean? But you also, there's a lot of people like, they enjoy the thing, right? Like I enjoy wrenching on cars and I'm a mechanic. So I started a mechanic shop. Pretty soon it's like,
You're not wrenching
you
on
wake
cars.
up and I'm like, shit, I don't get to wrench on cars no more. Dude. I'm trying to figure out how we get, so I think as entrepreneurs or business owners, being honest with yourself about where do you actually want to play inside your business is a key thing because the team you built is, executive assistant or receptionist, or you built a team around you so that you could do the part of the business you love, which is interacting with the clients and helping them out. I'm assuming he built his business differently, but I'm gonna go out on a limb and say maybe he doesn't have as much of a passion for the practice of chiropractic as you do.
Oh, as much or more.
You think he does?
Oh yeah, absolutely.
Oh, see, I was wrong.
Wrong again.
No, he.
Damn it! How many times have I been wrong on camera this week?
At least 4.
He's such a. I mean, it's kind of funny. People have those necklaces when it comes to life things. What would Jesus do? When it comes to business, I just think, what would Eddie do?
Yeah.
In fact, just a couple of weeks ago, I found out that there was another office that did some shady stuff on Google. That anybody type in my business name and it would go to their website.
Really?
Yeah. So
that was me.
So anyway,
I just had nothing to do on a Thursday, and I was like, I'm gonna screw with Ray.
Yeah. But how we found out about it was interesting because I have patients that come in from all over the area. I mean, Colville, Cheney.
They're trying to get directions.
Well, the thing is, if people call, even if they're on their way and if they're on their schedule, because we don't turn away any walk-ins either, so people can just walk in and get adjusted if, depending on, but if you're on the schedule, on the books, then that takes precedent over a walk-in.
Sure.
Right? And so he's like, and he came in from Cheney, he goes, I tried to call like 3 times, but every time I'd, put your name in my Google search, it would come up this other website. And he did it 3 times right in front of me in my waiting room. And this was 3 weeks ago. And what I should have done is I should have videoed it with my phone. I neglected to do that. But he showed me every time he did it. They went to this other website, this other chiropractic office. And so my office manager, I don't know how she did it. She got a hold of Google. And then Google made Google realize what was going on. So they gave us the name of the doctor that actually put it in play.
Oh, a doctor did it.
Oh, yeah.
So it's directing to competition.
Oh, yeah. Right.
Oh, that's shady.
Yeah.
Shitty and shady.
Yeah. Yeah. I was pretty hot, because, like I said, I've built my brand over 31 years. And if let's be honest, people are lazy. They'll go in, they'll type in my clinic name, it goes to the other website. Do it 2 or 3 times. Well, he must be working at that clinic. So they call that clinic and it's scheduled there.
And they don't know if they're working with you directly.
Right.
Right?
Right.
Yeah, interesting.
Yeah.
Genius.
And so
we did that to Synergy the whole time. So actually, that's how we got our brokers.
So
looking to join a brokerage.
Yeah.
So Synergy rejected.
Yeah, but I knew I needed to call and confront him about it.
Yeah. Oh yeah.
And so I called my buddy Eddie, and he's like,
"What would Eddie do?"
Right. And he goes, that is just gross, and he goes, it's just a horrible way because you built yours from nothing and they're trying to, piggyback on your coattails, and he goes, you absolutely do have to call and confront them. He goes, but Ray, he goes, I've known you since we were in our early 20s. He goes, and I know your temper. He goes, you can't lose your shit. And you got to stay calm when you call. So I call him up. Receptionist answered the phone, and I said, well, can I talk to one of the doctors? And can I talk to this one doctor? Well, they're all busy for another couple hours. There's 5 doctors in the office. Yeah, right. They're all busy. And she goes, well, what can I help you? I said, well, my name's Ray Sicilia, and Sicilia Chiropractic. And we found out a couple of weeks, this is about a week ago, later into it, that, one of your doctors did some shady stuff on Google to where people would type in my clinic name and it would go to your website. Well, we would never, blah, blah, blah. I said, no. I'm not playing that game with you today. I said, I know it happened. I know the name of the doctor that did it. I said, we contacted Google. Google knows you did it. Google shut it down. And now Google said they're investigating you. So I just want to let you know that I know that this isn't happening anymore.
Wow, nice.
And I said, you have a nice day. And then when I got off the phone, we looked up their website, and the gal that I was talking to was the wife of the doctor that did it.
Oh.
Yeah. So obviously there was a reason why she went just over the top defensive. We would never do anything like that. No.
Anybody who's that defensive,
Yeah.
you did it.
Yeah. Yeah.
I watch enough crime movie shows. It's definitely
Yeah, but how twisted would it be if like the doctor didn't actually know because he was out like doing adjustments and his wife, who's like head of the thing, was doing the marketing.
Yeah.
And like maybe she did it.
Maybe she
you
did it.
actually confronted the person who actually
did it.
Yeah.
That's a definite possibility.
Yeah.
You know, and the thing is,
never know.
there's I used to work out at Chrome, and there's a guy that's an attorney, just got it. He graduated Gonzaga last spring, fresh out of law school, passed the bar in the summer.
Poor guy.
And he's working for the prosecutor's office now, right? And I was talking to him, and I told him about it, and he goes, well, there are channels. If you really wanted to pursue it, it would be some kind of employment law, violations or something like that. And like, you just see the wheels turning when I'm talking to him about it. You know what I mean? And he's a pretty brilliant guy. I mean, he's pretty yoked, but he's a smart guy. You can tell just by talking to him. He really
clicks. Yeah.
His words are very well formulated, when he has a conversation. Yeah. And so he's almost like, it was almost like, how can I help you do this type thing? You know what I mean? Yeah. But I was like, the last thing I want to do is sue another chiropractor, So my opinion is I'm going to let that sleeping dog lie. But if I find out they're doing it again, I have a cousin of mine, Liz.
Now he goes back to the Sicilian thing.
Oh,
like,
boy.
I know a guy. I got a guy who's going to handle this.
Well, you know Liz. Liz Mosey.
Yes.
Yeah. Yeah, she works at Winston & Cachet, and the nickname is Wincash. And I just said, well, if I find out what's going on, I'll just call Liz and have her get me in touch with one of their attorneys that, if I make money, then they make money type thing.
Yeah.
But I mean, I that's the last thing that I would ever want to do is sue another chiropractor.
Yeah,
and it's just not good for the profession.
There's not a win in it. Yeah.
No.
But confronting, I think, is good.
Yeah. Oh, yeah.
Like not letting it, you can't let it go without being addressed, though, either.
No, it was definitely a jab in the ribs for me to call them and confront them about it. And of course, I said, well, please have one of the doctors call me back. Well, I shut down at 6.
I'm just glad you did it on the phone, Ray, and not in person.
In person?
Because I
He's
also
just sitting
know.
waiting in the waiting room. I want you in my waiting room.
I'm here to talk to Dr. So-and-so.
Yeah.
Tell him I'm in the lobby.
That's just one of those tough ones. Business is hard enough as it is.
Yeah.
Let alone when you have to go mitigate some of those parts of it.
So I'm curious about this, Jordan. Have you ever almost come uncorked? Have you ever? You don't seem like you have much of a temper.
It's not my personality. Yeah.
You're pretty.
You'd have to do something.
I have a few stories I'm not going to share that I'm pretty embarrassed about. There was definitely a younger Keith that I was in a few lobbies, dude. I was definitely in a few lobbies.
Oh,
I'm here to talk to so-and-so, and they're in the back going, there is a fuming mad 29-year-old out in the lobby pacing back and forth, adjusting his tie.
That's funny.
Well, I tell you, when I was first in practice, I got into, I started sharing space with another chiropractor up at the Y. And, I'm practicing, and I had no idea what I was doing. But the thing is, my brother's ex-girlfriend called me up one day, and they dated for like 7 years. So to this day, she's still like a big sister to me, And she calls me up and she goes, I don't know what's going on, but I've sent 8 people in to see you this month, and they're all seeing the other guy. Oh, like really? And this is 1996, so this is pre-HIPAA. All we had for the patients that came in, we just had sign-in sheets. Yeah. And so she gave me the names, and I went over to his sign-in sheet. Because at the end of the day, 8 out of 12 people he saw that day were on my list. Right. So, and the thing is, just prior to that, I started working on a good friend of mine that I've known since 7th grade, her and her husband. And they just happened to drive by on a Saturday when I never worked Saturdays back then. And the guy just happened to be there doing some like crown molding or other bullshit on the office, just doing a little minor construction. And they drive by, saw the door was open, pop in to get an adjustment on their way out to Diamond Lake. And boy, now they're his patients, right? And so that really just hit me the wrong way when I found out.
I don't think I get mad. That would make me mad.
So I tell this guy when I found out about the 8 people that were seeing him, I just went up and I said, we got to have a talk after work, and we shut down at 5. In the front of the office, a big, huge picture window said chiropractor on the front of it. So, we shut the doors and lock it up, and, he sits down in front of the window, and I sit adjacent to him. He's like, okay, what's going on? I said, well, I don't know. You tell me. I said, I got 8 people on a list that were referred in to see me this month, and you saw all 8 of them today. And he says, well, You do eat Thai food in the office and it stinks. True story.
That was his response?
That was his response.
Tough.
So I was only 26 years old. You got to understand.
Was this an older person or same age?
He was
building your business?
about 10 years older than me. And him and his wife,
A lot of response.
him and his family had just moved to Spokane like a year before that.
I don't
from
understand
Seattle.
the response. So he was saying it was
Because he was eating Thai food and stinking up the office. He took his clients.
Yep.
because he was mad at you?
Yeah.
Yep. For eating Thai food in the office. That was his excuse.
Oh, okay.
So you got to understand, like, I am proof positive men's brains don't mature until you're 29, at least. Right?
Because
that- maybe longer.
Did you throw him out the window?
All of a sudden,
that
new
was my
window.
first thought.
Yeah.
I mean,
I'm
honestly,
gonna throw this dude out the front
I
window.
just wanted to grab him by the throat and throw him through the window.
Yeah.
You know, and at that time, I mean, I was strong. I was really strong.
Oh yeah, there's some great pictures of Ray. If you ever go to his house on his mantle, Ray used to do like the flex. What do you call them? Bodybuilding shows.
yeah.
Ray was jacked, dude.
And I mean,
I don't think I'm screwing
We
the
don't look
26.
tiny
I don't think I'm
even
screwing
now.
the 26-year-old Ray, dude.
and just pissed beyond belief, you know. And so I had a moment of clarification. Ooh. And I said to myself, I don't want to go to jail today.
Oh, I thought you were gonna say I really like that window.
That's at least a day's later. Yeah.
So I stood up and I walked around the big, tall receptionist counter just so I knew that I couldn't physically grab him and do anything to him physically. And I said, let me paraphrase what you just told me. You're stealing my livelihood because I've eaten Thai food in the office like 2 or 3 times. Well, I don't know, I guess. Right. And
That's not even a good follow-up.
no,
That's worse.
not at all. Not at all. And so then I tried to reinvent the wheel and made things worse when I moved out by myself, you know. And then that's when, you know, I moved in. I switched the location to Francis and Division, high dollar area. Couldn't afford the rent, had to move out, skip out. My landlord was very gracious. I basically gave him about another 20 years of free chiropractic care because he let me skip out about 4 years early on my lease, you know, because he knew I just wasn't making it.
Yeah.
I was going down. So I moved about 8 blocks away down Wall Street by right off Rowan and instantly saved like $800 a month just on rent, you know, and which allowed me to eat something other than ramen, you know, and then soon thereafter joined that practice management group and things just started to pick up, you know. Yeah. But, you know, it took me a long time to forgive that other chiropractor for doing that. And in fact, when I started dating Laura, her Second Wind coffee stand that she was working at was up. It's now the Bruise Brothers in front of like Carl's Jr. that's right there in front of Highway 2, right there by Frank's Diner.
Mm-hmm. Oh, yeah.
And so I would, you know, drive all the way up there to go get my coffee in the morning before I went to work, you know, just go see her. But I'm not going to say what I would say when I drive by his office, but it wasn't very good. And so it probably took me a good, I don't know, 8 or 10 years to forgive him. Never forget, but to forgive.
Right.
Because he didn't give a shit.
No.
That was not his stress. All that stress was on me. And that was holding me down.
Yeah.
You know, that was weighing me down so mentally. And that was another thing, dumping some of the bullshit that you've dealt with and you know, just moving on, you know.
Yeah, it's definitely a life lesson, man. I tell you, I was joking around about being in lobbies when I was young, but there was a.
But I was in.
But I was. There were a few times. But it was 2-3 podcasts ago. We were talking to Justin Avey, and we were talking about best deal, worst deal.
Oh yeah.
And I shared a worst deal on that podcast.
Whitney still can't believe it's true.
Yeah, that's a true story. But the same story was I ended up orbiting around this contractor guy who had ripped me off for the tune of about $50K for years, and like I literally just wanted to murder the dude, right? Like just literally couldn't stand, you know. And I got to that point where I was like, Keith, this is eating me up, right? And I wasn't getting the money back anyway. And but he was fairly flippant like that. It was kind of like that. Like it was kind of like, hey man, I had to do what I had to do, and sorry it didn't end up in your, you know. And it was
They didn't
like,
care.
You mother truckers like stole money, right?
Right.
And but it was probably eventually I kind of like just had to forgive the guy, like in my own heart, like in my own soul. I had to just like literally be like, you know what, man, you gotta just like let this go. And it was funny because then I probably 2, 3, 4 years goes by, and other than the memory of it, really just never, you know, wasn't an issue. And I run into the guy, and I ran into him at like a social function, probably like, you know, 8, 10 years after. And I remember I saw him, and he did not look good. He did not look good. He looked like old, and he looked stressed, and I was just like, I don't know. I remember for a minute, man, I just felt bad for the dude. Yeah. I was like, man, that poor bastard, dude. Like, you know, like I don't.
Well, if he did it to you, how many other people did he do it to?
Oh, and that was the thing, was that can of worms unraveled like lots, actually. I ended up having conversations with a multitude of people that were before me. I ended up having conversations with people who were after me. And it was one of those things. Dude was just a crook. He's just a crook.
Yeah.
And it was one of those things where, you know, word finally got around enough that I think he had to leave town. Yeah.
Well, Spokane is the biggest small town in the world.
Trust me.
And but it was one of those things like, going back to that, it's like growing up, it's like, I guess if I were to tie a little bow on this conversation of the business aspect of it is, hey man, in business, like as much as we tell stories about failure and success, and it's easy enough to own them when they're both yours. But then there's also, if you're in this business long enough, you will be wronged. You will be, and not just like,
not
the market
kinda.
turned and you caught with your pants down, or like that deal should have gone through. Like, no, like somebody's going to like steal from you. Somebody's going to like, you know, wrong you. And like, that's one of those points of business where it's like, you got resilience in business is also just getting through those unfortunate situations where there's either you're going to jail, like I'm going to go to jail for this stupid effing dude, or you're going to like take it. And that's just one of those things where it's part of business. I mean, if you're in business long enough, man, you're going to kind of get bent over a time or two. And that's going to be one of those things where they become fun stories to tell maybe later.
Yeah.
But in the moment you're like, how is this fair? How's this right? Well, it's not. And it's part of the deal.
Yeah, definitely not. And it's hard because then you look at it and you blame him immediately, right? You tell that story, you blame him, but then it's like, well, what practices did you put in place to collect the clients?
Right.
What did sign-in look like? Like, think of the things.
The
so
things
that's
that
how
you
two people
changed,
could have taken, right?
Well,
and you can
out-
take that defeat and be like, wait, F that guy.
Yeah.
And over here, you're like, wait a
Yeah.
second. Why am I not the direct contact? How does it, and that's what helped me the most. So where I don't get too upset with things, it's like, yeah, that sucks. But if I carry that weight, I'm never going to fix and adjust and move forward here.
Right. See, and the guy was shady because the thing is that what I found out was he was instructing. We had one receptionist for the office for both of us, and he told her that every new patient that called was going to be his new patient. Right. So she's just following orders.
Well, that's an outlier. Never mind. That is a dick.
Yeah. Oh no. And the funny thing is, you know, I ran into him we don't get a lot of seminars here, for continuing ed in Spokane, and there was one, and this was probably, I'd say 2018, 2019. It was pre-COVID, and it was a lot. I mean, the auditorium was packed because, like I said, we don't get a lot of local stuff, and so I walk into the room and I see a buddy of mine. I go to shake his hand, and when I came into the room, well, there's the guy, right?
Always.
So I'm like, don't be a dick. Don't be a dick. So I walk over to him and hey, I won't say his name. Hey, how's it going? Shook his hand, and then it started talking to my buddies. And so his wife was actually a chiropractor too. So they were like 4 or 5 tables ahead of me and where my buddies were sitting. And so at the breaks, he'd come back to try to like talk to me, and he'd get like 2 feet away from me, and I'd just turn my back on him. Yeah. I'm like, I'm not going to talk to you.
We're not there yet.
Yeah. I mean, I might have forgiven you, but that doesn't mean I like you. Yeah. And that doesn't mean I'm going to waste my breath talking to you.
Well, and it's right. If you take that even back, like further, it's the response. Even it's not even the act. If the act would have been you sat down and said, "Hey, look, these guys came in. I was struggling here. This is what I'm doing." It's when you go the other way. It's when it's like, "Nope, sorry, I just took your money."
Yeah.
Oh, you had type, and it's like, no, just own the thing. Mm-hmm. And you watch people can at least work through that. But it's when they go the opposite way, it's just this repulsive element to it. As the lesson I had to learn through, it was like, hey, look, as you're building and raising and doing these projects, like just say it, just say it, and go, because it's not gonna. I don't think it heals it that day, but at least you're not
stewing on it,
throwing through a
years
window.
and years. Yeah. No, and like in business for me, I mean, it's about learning a lot of it. I've been screwed by a lot of attorneys, because they, one in particular who I'd known forever. I mean, I went to middle school with his daughter, and he sent me a couple clients, and then I thought he was on the fairly up and up, and he ended up jacking me for like $15,000, for a couple different clients. I mean, total, and it's like not recently, but he since passed away. But he was just a scoundrel. When you say his name and the word in any kind of arena with attorneys, I mean, it's like, oh my God, you know him? You knew him? Oh, he was horrible. He was the worst.
You have no idea.
Right.
Yeah.
And he screwed me over bad, and he screwed over the patients too, which was even worse.
Yeah.
So there's you learn who to work with, and who to stay away from. And it's gotten to the point where patients come in for a car accident, whatever, and they say, I have this hernia. I said, well, you got to see somebody else then. So I'm just not going to take the case. It's like when I went on Judge Judy, And
you went on Judge Judy?
Why
I
didn't we
forgot
lead
about
with
this. Yeah, I
That's
forgot
kind of a
about
big
this. I
piece.
didn't remember this, but now I'm remembering it even better. Me and Ray go way
that's
back.
cool.
Yeah, you went on Judge Judy.
in fact,
That's right.
they just aired like last week. So we got like 50 phone
recently
calls.
went on Judge Judy.
No. It was like,
But re-aired.
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 And so when it re-airs, we always get like 50 phone calls. Hey, I just saw Dr. Ray on Judge Judy.
I'm going to check out that one.
And so the story was the guy gets into a car accident. He owned a bar restaurant up on North Division, closed down after, at time, driving home at like 2:33 in the morning, gets smacked in the middle of an uncontrolled intersection and ends up in somebody's front yard. He got totaled his car. I mean, he was pretty messed up. And so he starts seeing me. And, the thing is, every single time a patient walks in, every single patient, doesn't matter what they are, LNI, cash, insurance, personal injury cases, they all fill out these pain drawings. Yeah. And that's how we track our patients. But it works well with like court cases and stuff like for personal injury. Yeah. So anyway, so it was 4 months of care, steady care. And when he started, he was like a 9 out of 10 in pain. When we finished, he was a 0 for like 3 weeks. So I can't keep treating if he's fine because I got him back to pre-injury status. And that's the goal of care for a personal injury claim, So we concluded care in late August. And so it took Safeco until next May. They called me because I didn't file a lien with it. The guy catered my wedding in 2001. I'd known him and his wife for like 20 years. Oh, wow. Right. So am I going to think the guy's going to try and screw me over? Why would I think that? So, that next May, Safeco calls me and said, here's what's going to go on. You didn't file a lien at the courthouse. Well, I didn't think I needed to because I'd known him for 20 years, right? Well, we're going to pay him to pay you. So your money is in his check. So make sure you communicate with him that your fees are in the check that we're going to cut him. So I sent him a big, long message, because I'd been screwed. Because money makes people funny, as you well know. Yeah. I mean, as every business owner knows, money makes people funny. So anyway, I said, I don't want to get screwed again because people will pay the patient and they just get the money and they're gone, right? And anyway, so he's like, as soon as I get paid, I'll send you a check. So that was.
Oh, so you sent him a message and he agreed?
Yeah.
He was like, oh yeah, no worries. When I get my check, I'll pay you.
Yeah.
Oh yeah.
That was in my evidence too with Judge Judy.
Yeah,
I took a screenshot of that.
Oh, you had a screenshot.
Oh yeah.
Oh, nice.
I didn't erase anything.
Oh, nice.
No. So anyway.
So this is all leading to the Judge Judy thing.
Yeah.
Uh-huh. Okay.
Yeah.
Nice.
So
spicy.
Later, so fast forward till September. And I'd seen pictures of him and his family in New Orleans that summer, right? Just a little foreshadowing there. So anyway, fast forward to September, I said, okay, what's going on with the claim? Well, they only want to pay me $1,500 for all my medical expenses. I said, well, he goes, I got to get an attorney. I said, well, get an attorney. Just keep me in the loop. You're good. And he goes, will do. And so don't hear nothing. Fast forward to, it was Valentine's Day the next year.
So this is going on like a year and a half. You haven't been paid?
Oh, yeah.
Almost so. Yeah.
Almost two at this point. At this point.
Jeez. Right.
Full cycle.
Yeah, and so he messaged me back. I sent a message. I said, look, if they're only willing, you haven't contacted me about it, the attorney, what they're going to say. I said, if worse comes to worse and they're only going to pay $1,500, then that's mine. I said, I paid the massage therapist for your care. I paid my taxes. I paid my bills. I paid my rent. That money's mine. And he goes, well, I'll have to get you the $1,500 when I get my tax return. And I thought,
so he'd already spent the money.
Oh, that's gone.
She
gone.
I said, that's a little fishy. So we called Safeco. And they're like, oh, no, we paid him like 2 days after we talked to you last May.
Last May?
Yeah, the year before. So
Did they allude to you what the payout to him was?
It was roughly the $1,500 was for him.
No. What I'm saying is, did they allude to you the total payout?
Yeah.
It was yours plus the $1,500.
Yeah. My bill was $5,000.
Oh.
Basically straight up $5,000. $4,800. And so that $1,500, that was money that he was supposed to get. The $5,000 was mine. And so anyway, if he would have got a good attorney, things would have been different, But he decided not to, and just take my money and try and get away with it. And so anyway.
So how do you end up on Judge Judy?
I'm getting there.
Okay.
No, this is good.
So we start sending him bills, and I have Legal Shield. And so we had Legal Shield send him a letter, no response at all. So I wasn't going to go through collections because collections will take a third. I'm like, I'm just going to do it in small claims. So go down and file it small claims. Within a week, I get a letter from the producers at Judge Judy saying, we saw your claim. We've seen your claim.
We tracked your claim.
We tracked your claim.
That's probably how they get all these cases,
Exactly.
right? They track small claims court
They said
cases.
they look at thousands of cases a week, and they found mine, and they want to get me paid. And so they like,
cool.
if you come down, we'll pay for your flights for you and your assistant. We'll pay for your hotel. We'll pay for your cab rides. The only thing you're responsible for is your meals, and we'll give you $100 a piece on top.
Yeah.
Per diem.
So
Per diem.
Does the other party have to agree to be on Judge Judy?
Yeah.
So both parties have to agree to do it. Yeah.
Yep. And the thing is, you ever wonder why people go on those shows? It's because the show pays their debt,
Sure.
right?
Sure. So if he wins, great. If he loses, the show's going to pay you what he owes you.
Either way,
Right.
you agreeing to that, you're going to get paid.
Yeah.
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 Oh, geez.
Because it's cut and
Yeah.
dry.
Yeah.
You know. So we go down, we get on the show, and
How was it hard to get him to agree, or did you have to do that, or did they do that?
they contacted him.
Okay.
And then last minute, like 2 or 3 days before we were supposed to go down, he messaged me, I don't think we're going to go. And I'm like, what
We're
the
going.
fuck,
Yeah,
dude?
we're going.
But I guarantee his wife gave him the proverbial shot to the nuts and said, no, we're going to do this. You're going to get Ray paid, because if not, this is going to be on our credit report for 7 years at least.
Yeah.
Oh yeah.
Yeah.
Yeah. So there still was some motivation on
Yeah.
there to go.
Oh, yeah, absolutely. Get their debt paid. You know, plus they get $100. They get a free,
Yeah, I was
free
gonna
trip
say,
down to
that's
Hollywood, you know?
And the debt paid.
Yeah.
Yeah, you just have to look like an ass on TV.
Yeah, exactly. So we went down, and on the episode, you know, she starts asking me a couple questions. Where'd you graduate? You know, is that a doctorate degree? And I'm like, yes, ma'am. And she starts calling me Dr. Sicilia. I'm like, oh, this is going in the right direction, you know, because she can be a little pit bull. I mean, if you watch Judge Judy.
Yeah.
And so she, so she starts asking him questions. He says, well, I don't really think, he goes, why didn't you pay your chiropractor? Well, I really didn't think it helped. And right, exactly. So I got prepped by some producers. We were in a room about this size, about 15 by 20, and this producer starts screaming and cussing at me. You might not get paid if you don't know every ins and out of your case, and blah 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 blah. I'm screaming and cussing at me. I'm like,
Before?
before.
Oh, before.
So I went through all the notes, and I'm like, so I knew that case backwards and forwards before we walked into the room.
So they were all aggressive with you before.
Oh yeah,
Like, hey,
yeah.
man.
They want to rile you up.
They
They want to
trying
get you fired up.
Yeah, trying to get fired up. Yeah.
So the fact that they told him,
That's pretty good.
the fact that he said that it didn't help, he knew it helped.
Yeah.
And so did his wife. And so it's just the fact they wanted to dramatize it. And so anyway, it ended up coming out in my judgment. But, but what I neglected to do was say, Your Honor, you have copies of all the pain drawings that he filled out every single visit he walked into my office. And when he started, he was a 9 out of 10. And when we finished, he was a 0.
Yeah.
So I have to conclude care because he had no pain. Yeah. He was perfectly fine, perfectly back to normal. And I neglected to say that. But I just figured I'd let it roll. And
So did Judge Judy give him the hammer?
oh yeah.
Oh, that's how I'm going to watch that one.
She said to him one time, she goes, have you ever known anybody that's gone to the hospital and they were there for like a week and then they died? Do you think the hospital didn't get paid?
Yeah.
You know?
Oh yeah. So she was okay.
Yeah.
Yeah.
Oh, yeah.
That's a good point. Yeah.
So, but it was, I'd do it again
cool.
for $5,000, you know? But I mean, funny thing is he got in another car accident.
Jeez, of course.
Running
karma's
thing.
bitch.
Yeah.
Well,
Hey.
and the thing is, like I said, I'd
Hey-o.
known him for so long, and he called me like 3 years later. He's like, hey, my back's really killing me. I understand if you don't want to treat me. I'm like, just come on in. You know, my door's open. Come on in. And I worked on him. And then this last year, he got into a car accident. So he shows up without making an appointment. And for a car accident, I mean, that's a pretty involved history evaluation, usually x-rays, stuff like that. And I pulled him aside in my room and I said, here's the deal. I said, if you don't have PIP, I said, I want you to find out if you have PIP, personal injury protection insurance on your car insurance. I said, if you don't have PIP, then I'm going to be charging you full price per visit every time you walk in the door. Well, let me go talk to my insurance agent. I said, just call her. No, I better go talk to her. I said, no, just call her. No, I have to go talk to her. And he starts stuttering and gets all nervous and, okay, well, just let me know what they say, Yeah. Never came back. Yeah. But my staff, because they knew the story,
Well,
they
all
all came. They came up and hugged me and they're like, thank you. We didn't want to say anything, but we're so glad we don't have to deal with this.
I bet. Well, Ray, man, thank you
man.
so much for your time.
I know what
today,
homework
dude.
is. That's pretty good.
Yeah, go watch Judge
My
Judy.
pleasure.
Seriously, thank you so much, man. Another Spokane legend here in the business world, and I appreciate everything you've done, and look forward to doing this again.
Absolutely. No, this is fun.
Yeah. All right, you guys, thanks for listening to today's episode. While you're out there, would you please do us a favor and give us a like, subscribe, or a follow, whether you listen on Spotify, iTunes, or YouTube. We'd really appreciate it. Also, if you don't mind while you're there, give us a 5-star review. Maybe write a review. If you have a favorite episode, feel free to give it a like. Thanks for listening. We really appreciate it.